Dear audience, today I will demonstrate in front of you an ultramodern technologies which added with medical science, especially in the field of surgery. These procedures known as laparoscope or laparoscopic surgery. This laparoscopic surgery is totally changed ideas of medical science, especially in the department of surgical emergencies. Laparoscopic surgery is not only a modern technologies procedures. As per my knowledge, the laparoscopic surgery is a great revolution in modern medical science. The laparoscopic surgery is decorated with biomedical technologies and biophysics. Although in Bangladesh, laparoscopic surgery has minimum rule of practice, but in the modern world, laparoscopic surgery is more trusted, more reliable, more famous than open surgeries. These procedures of laparoscopic surgeries is ongoing secondary or tertiary level hospitals, private clinic, medical college hospitals, and medical universities worldwide. All kinds of medical professionals, doctors, nurses, and medical specialists, and those the people are interested with laparoscope and laparoscopic surgeries are invited to follow this phase. Innovation of laparoscopy is revelation in surgeries. Also invited to subscribe my YouTube channel. Comment with your valuable information and cooperations for the positive background of laparoscopy in Bangladesh and for the benefit of the patients. Now I will describe what is laparoscope. Laparoscope or laparoscopic surgery, also known as a robotic surgery, also known as a keyhole surgery, it also known as minimally invasive surgery. In these procedures of laparoscopic surgery techniques, a big operation is completed within a small incisions. In these procedures of laparoscopic techniques, the surgeon make out 1 to more small incision on abdominal wall around umbilicus about 10 mm or 15 mm. These 10 mm or 15 mm fold give the surgeon to access abdominal cavity, peritoneal cavity, and pelvis. Entrance with the laparoscopic telescope, laparoscopic cameras, and carbon dioxide gas. That helps to surgeons complete operation and more visualization of the operation field. After completing the operations, carbon dioxide gas is taken out from abdominal cavities and incision are referred with sutures. After irrigations the operation is completed. For these reasons of small incisions, the patient is benefited in many more by the economically and save the times. The patient is benefited. Number one is a small incision on abdominal wall. So small surgical scar is abdominal wall. Less tissue injury. Number three, less nerve injury. Number four, less chance of bleeding. Number five, minimum chance of infection. Number six, less pain. Number seven, less complication. Number eight, minimum post-operative care. Number nine, minimum post-operative drug. Number 10, minimum stay in hospitals. Any kind of laparoscopic surgery, the patient take out hospitals over a day or over a night. Thank you for watching videos completely. Goodbye.